The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hi there, and welcome to Healthcare Hour with Colleen Qvist. I'm sure that you are experiencing different weather depending on where you are. Certainly in the Southern Hemisphere, we are rather cold at the moment. But be that it is May, of course it's winter in the Southern Hemisphere, and so we must expect to be cold. Thanks for all your messages. Thank you for all your interaction with the show. Hello to all the countries other than South Africa who do listen to us. You're very welcome, and we'd love to hear from you in person. As you know, Healthcare Hour is all about healthcare professionals. It's about us understanding that they are real, they're people, they get hungry, they get tired, they have families. It's also about us improving the relationship between the healthcare professional and the patient. And of course, understanding that at some point, unfortunately, we all will be patients, or we know somebody who is a patient. And so how do we make it better for everyone? The show, of course, has got different guests every week, and this week is no different. After the break, I'm going to introduce you to a visionary healthcare entrepreneur, and he's quite fascinating, so I thought you'd like to meet him. But let's go for that break.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Lubabalo Mnyaka. And as I said before the break, he is a fascinating entrepreneur who works in healthcare and is doing his best to make things better for people who need healthcare. So Lubabalo, welcome.
Thank you so much, Colleen. What an honor to be part of your show. Thank you.
Yes. So if some of your friends are thinking, who on earth is Lubabalo? I know that you're also known as LJ.
Oh, yes, sure. Yeah, Lubabalo is such a dreamer. I'm a guy from, I'm just a boy, a young boy from, Eastern Cape. I grew up in Zandugwane and a small town called Libode. So I originate there, but I'm currently residing in Pretoria.
Okay, so from Eastern Cape to Pretoria.
All
So
right.
talk to us about, what I always said as well is that our roots inform what we do. Where we come from informs what it is, what the difference that we're wanting to make in the world. So how did you come to be this healthcare entrepreneur now?
Sure. I think when I was growing up, in fact, I could say that it was between being a medical doctor and electronics engineer. Just to, go back, I believe some years back, I think I was around 7 or 8. That's where I built my first doorbell for my mom. So basically, I took, some worn-out materials and motherboards and managed to weld together something that could be used as a doorbell. And my mom was just surprised that at that age I could build such things. And then from there, I was just experiencing with different things, electronics. And I was also selling things like peanuts. And so I've always been driven as far as selling things, And then as I grew as well, I got more inclined to healthcare side. As such, I had thought I would become a medical doctor, but growing up from rurals, my marks weren't as good. As such, I had to go through the BSc route. This is where I did my undergrad at the University of Free State. And then from there, I had hoped that I would actually move to medicine, which indeed I applied at WITS at the GMP program. But after some consideration, I really thought, you know what, I don't think my role is really in applying medicine, but it's more on creating tools to make healthcare delivery as seamless as possible. And I'm using my interest in tech and also my interest in healthcare. So I managed to bridge that gap. And prior to that, I worked for a pharmaceutical company, Merck Pharmaceuticals. This is where I really fell in love with healthcare and also got to see gaps in healthcare delivery. And yeah, that's been my journey as far as, you know, coming from rurals to being a health tech entrepreneur.
Isn't it fascinating, Lubabalo, how doors close in our life, you know, with that not getting into medicine and then doing the BSc. And, you know, I know you did microbiology. Same for me. I also didn't get into medicine. I did biochemistry and genetics. And then
Wow.
along the way, I went into sales and spent 22 years there and now I coach. So the purpose has always been the same, just the delivery vehicle is different.
Did. Yeah. Wow. Wow. You've really hit it because from a very young age as well, like I was really, you know, convinced that I need to go via the medicine route. But as more options were laid on my table, other doors closing and others opening, I think I'm actually at the right place. And had it gone the other way around, I think I would be miserable.
Yes. And so to all the young people listening to us, and also I do work as well with a lot of doctors who question if they're in the right place. Should they really be here? Do they want to be somewhere else? It's also, you know, it's never too late to actually sit down and to look and see, okay, where could you be? Where should you be? But
Yeah.
as you know, there you've got your two loves of healthcare and making stuff, you know, electrical, plus entrepreneur, because I can see, you know, selling peanuts as a boy. You know, hopefully you don't sell peanuts anymore. Um, but but it's just how it's all come together for you.
Yeah. Yeah, indeed. I do think, yeah, a lot of times we find ourselves misplaced. One, the societal standards that we often push ourselves to meet, because especially coming, you know, from previously disadvantaged areas, so being a doctor or an engineer or a lawyer, it's, you know, you really get your flowers from the community. Not that it's something you love, or sometimes you just want to impress your parents, but you find yourself in this dark hole. So I do think we've been fortunate that destiny sort of arranged where we are right now, because even some of my clients, which are medical doctors, you find that they're not really happy, they're not really passionate about what they do. They would even be interested in trying out other things within the practice of medicine than running their daily primary healthcare services or becoming specialists. So
Yes.
indeed, we do get lost in the journey, and we are fortunate to actually have found out if really it's something you love, or get an opportunity to actually try something else. And we often think it's too late, and it's actually not, because life can be very long, especially if you're in a place that you don't really like.
And what's nice in that as well is that it's not the or. I can be a doctor or an engineer or a
Mm.
something or a whatever. It's also looking to see the and
Oh,
how we can be multi and not singular.
oh yes, especially the times we live in now. We live in
Yes.
information age. So you really get to apply all the knowledge that you have, and it can't be from one source. So just to affirm what you've just said now, that indeed we do need all these skills and expertise to become specialists in one area or multiple areas.
Mm. And so, yeah, while we're there, where you've mentioned, you know, lots of doctors who think, oh, what else is out there? Do
Mm.
you offer like, you know, I was thinking like at school, or certainly with my daughter, where she was at school, you had a job shadowing day where you could like go and job shadow for the day. Do you offer that?
No, actually, that's something we're trying to do with our rural project. So there's a project that we're running. It's mainly looking at making healthcare accessible and affordable in the rural areas, you find that the actual cost is the traveling of 2-3 hours seeking primary healthcare services, that you're trying to bridge that gap. And in the process as well, we want to inspire and empower matriculants and even younger scholars to expose them into healthcare as well, that they can make right choices early in their lives. So this is something that we haven't really done much, but I do think there's a lot that needs to be done there so that you're not surprised after your graduation and then you realize, wow, this is the reality, and you've wasted so much time in the process.
Yeah. No, so certainly to make sure that you are on the semi-right path right from the beginning. But I was also thinking about the people who are now qualified as doctors and are questioning, should I be here? And it's almost like they also need to go on a job shadowing day.
Yeah, and I mean, after such a long time, because from metric, then imagine like someone like ourselves, they've gone through BSc 3-4 years, and then from they start an undergrad MPhD, and then you add 5-6 years, they already be talking like 10 years, and then they have to do ComServe, they have to do internship. Then 13 years later,
Yeah.
after matric, that is now basically around 24, 25 years, then they realize, no, this is not what I want.
Yeah.
And that's the time where one should be really growing their career.
Yes. But it's also important, you know, when you look back and you think, gee, it's taken me 20 years to get here. When you think that you now, 40, for instance, you may have 30 years still going forward. And so do you want 30 years of misery going forward? So it's never too late to not necessarily change paths, but to add something to your path.
Indeed, but sometimes there's this urgent need to put food on the table, especially if you are the first generation in terms of financial freedom. So there is also that plays a role. You realize that you don't really like what you're doing, but there are 3, 4, 5 people, depending on what you're doing, though you don't like it, and they have no idea how miserable are you being a doctor. But they're so proud that there's a first doctor in the family, and from your side, you would like to teach this and start something else. So you caught in between.
Yeah, no, I certainly understand that. Okay, let's go for a break and then we'll jump into what it is that you do each day and what difference you're making. But let's go for the break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Lubabalo Mnyaka, and he's also known as LJ in some circles, certainly in his Zoom circles. And he is the founder and managing director of Aflu Healthcare. So, Lubabalo, let's hear from you. What does this company do? What do you do each day?
Thank you. Thank you so much, Colleen. Sure, I'll start with a sad story, but I think it sort of aligns us and puts us into reality, because a lot of the time we don't know what happens behind the scenes as far as healthcare. A patient is admitted at a hospital and they treated and then discharged home. When they get home, late home, they collapse. And then they're brought back to the hospital. And then on their return to the hospital, the file cannot be found. It means now everything that was done prior to the patient being discharged had to be redone again. And in the process, the patient passes on. This is such an unfortunate event. As we speak right now, government is sitting at 77 billion rands of medical legal cases, similar to that. And it all stems from a simple thing such as record keeping. Remember back in the days, you used to have your clinic card that you carried with you all the time. So your record was staying with you and you would just present it to that healthcare professional that you're visiting. They would have their notes and you still keep it with you. And somehow things change and that record started being kept at the practice, and you started making multiple records, and then that's where fragmentation of care started. So this is the first problem that we are solving. One patient, one health record. How do we make sure that we reduce the hassle to get proper, affordable, and quality healthcare? It starts with record keeping. So what we do is we've created a platform, a free platform, a lifetime platform, basically, that you can create your own health record as a patient, and you can pull together all the other records that you have with different providers and create this one record, the record that travels with you all the time. So the only difference now is that it's digital, so you can no longer forget it at home, or it cannot be lost now because it's with you wherever you are. You're able to log in and you're able to share or update your health record. So that's point number one. And then point number two is there are funders of healthcare, whether it's government or it's a medical aid or yourself, but someone pays for healthcare that you seek as a patient. And they want real time clinical outcomes. Has the patient gotten what is written on the file? Did they really get the care that they went for? And what were the outcomes? Currently, with the fragmentation of care, there's nowhere where that is recorded, and it leads to duplication of care, leads to fraud, waste, and abuse of funds. So we have these two key stakeholders, the patient and the funder. They're all dependent on clinical data. So we've created this environment that houses these two key stakeholders as the drivers for adoption in terms of digital healthcare. And then we have the primary client, which is the healthcare professional that wants to save time creating these records, 3 to 4 hours a week. They want to save that. They want to access healthcare information at a click versus having to page through files or having to fetch files from storage. And they also want to attract and keep patients. So this is our primary client. And the adoption by the primary client is driven by the patient who they want to service and the funder who needs to pay them. So in a nutshell, we create centralized healthcare information systems that enable a seamless delivery of healthcare. So we can prevent such instances as the patient passing on, not getting care speedily because they still have to redo tests that were done prior to that.
Yes. Yeah, so I mean, I totally understand. And I mean, even a first-hand story where the lady who works for me went to the hospital the other day and then went back for her results. And then I said, okay, what happened? And she said, no, they couldn't find my file. I've got to go back next week. Yeah, so a very real problem where also the file has got to move from one part of a hospital to another part of a hospital. So it's got to move from, I don't know, who knows, from room 1 to room 52. And it's also like where the patient has come back, although it was a week later, and the file's not here. So now we can't help you. We can't give you your results. We can't send you in the right direction. We can't say, oh, you need a follow-up test or, you know, any of that. And so off she went home again.
Yeah, that's really painful because I mean the stress of making your way to the hospital, and now you're being told the file cannot be found, and knowing what you went through to get to where you are now, so you have to start afresh again. It doesn't only waste government money. I mean your time, and that time whatever you're suffering from is not waiting for the file to be recovered. You're getting sicker, and things that could have been prevented, they can't be prevented because there's no file.
Yeah, and not only that, you also look at the logistics of the person having to take a day's leave, having to pay for transport to get there. Also the mental anguish of, okay, what do my results say? Am I sick? Am I not sick? All those kind of things. And then you get there and they say, no file.
Yeah, and it happens every day.
And
so
more
basically,
than once.
this is
Yes, I'm sure. Yeah.
this is what you're trying to solve. Like, did you know a 1,500 bed hospital, that is a public hospital, spends at least 78 million rands a year just on printing paper, and there's absolutely no value add because that paper cannot be found, or it incurs other costs like storage, etc. And such expenses, imagine how much can be done with such a budget, and we have over 400 hospitals. So if
Yes.
we're talking region of 70 to 100 million just spent on paper, by 1,500 bed hospital, you can imagine how much we wasting a year, and that could have been channeled towards other means of health.
Yeah. And then, of course, it's the logistics as well of, all very well, 78 million on paper, but you've also got to make sure that that's paper. It's not going to fade over the years. Or like you go back to get the records for Mrs. Blogs and, oh, hang on, we can't read it. It's all
Yeah.
faded.
Some
I
pages
think
are
of all
missing
our
from
credit
time.
card slips and our petrol slips that last like a day if you're lucky, and then they're totally blank.
Yeah.
Yeah.
So you would think these are no-brainer thoughts or solutions, but unfortunately, like I said, when you started with healthcare, it's all about trust, it's all about longevity, it's all about proven methods, etc. It's only now that we hear government talking about digital healthcare migration, even in the private sector as well. It's only now that we're starting to see a rise as far as adoption. Yet you would think, I mean, we've always had these technologies as far as 15 years back, but the adoption wasn't there. That, like I said again, maybe it is in how healthcare professionals are trained, or I don't know what seems to be the bottleneck, but adoption of tech in the healthcare industry is way slower than fintech and others, and it's actually costing the industry more than it's supposed to, because it's just way too slow, and we're not introducing new things. It's things that a patient can think of, healthcare professional can think of, but the problem is just taking that action.
Yeah, and even this week, I mean, I was talking to my own GP and noticing the thousands and thousands of files. And then I said to her, hey, why haven't you gone digital? And she was saying, no, they've tried, but there've been issues. There've been problems. It hasn't worked, And so now she just put it on the paper. So you
Yeah,
also, I assume that every day you come across people who are reluctant to change, or as soon as they hit one obstacle, it's like, oh, back we go again.
Yeah, and it's genuine concerns. I have to agree with them, because at times you find that these are systems that are created by good developers, but not from a clinical background. So they're only good on paper, but when it comes to now to work on the ground, the flows are different, and it sort of forces the practice to change its ways so it can conform to this software. And that never sits well with healthcare professionals. One, they don't have time to be trying all these systems to be correcting this or that. So this is why it's much better for us, because we coming from clinical background, and our team is as a team of doctors, etc. So even the system we built, we involved over 100 doctors building it. So you find that adoption is much better. And in fact, our struggle is usually getting the demo, because they would think, it's another electronic health record system, until they actually see our flaws. And finally, they're like, wow, we've been had, So I don't blame them for trying systems, and then they fail, and then they're like, no, what, let's just go back to paper, because how many systems are they going to try before they get it
Yes.
right? The time is not there.
Yeah. Yeah. And as you say, I mean, just before we go for our next break, it's also that you don't have time to go, now, where's that section now? Where must I fill it in kind of story? So it has to be in a logical order, and it's got to make sense, and it must flow. But then also when you want it back again, well, where is, like, hang on, no, it was there. And then you have this whole idea of, at least we had the paper. Now it's gone. It's somewhere out there.
Yes. Yeah. It's
And
one
then
of
that's
the
quite
issues.
scary. Yeah.
Wow.
Okay, let's go for a break. We'll be back.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Lubabalo Mnyaka, and he is the founder and managing director of Aflu Healthcare. And Lubabalo has been explaining to us that often what happens in all of our healthcare institutions, whether they're private or government, is that the health records disappear. And I know firsthand from the lady who works for me that she couldn't get her results from what she'd gone to because they couldn't find her file. And the suggestion was, come back next week when we'll have hopefully found it. So before we go into exactly what it is, you know what happens? We keep on hearing about people who have stolen digital records or have hacked them. So how are you preventing that? Because can you imagine if you ran away with everyone's medical healthcare records?
Wow, this is a valid concern, and I think it's one of the key barriers to adoption. So we always put it in the forefront in terms of making sure that it's the elephant that you address in the room, because you find that though some clinicians may not ask directly, but it's there, they're just not, asking, and it remains a concern. So there are quite a lot of standards, international and local standards, that one needs to abide by. And this starts with simple acts such as the POPIA. And we need to make sure that there is protection of personal information. And we do not own the data. The data is owned between the patient and the provider. We're just hosting data, and we need to meet at least basic standards as far as cybersecurity. We also have cyber insurance as well, should we be held at ransom for the information that we keep. But we have quite a number of layers of security that we have on the system to make sure that whoever accesses information is the right person. And we've implemented things such as audit trails as well, that at any given point I can log onto the system and see who accessed what, when, and why. More like your banking system. And obviously nothing is bulletproof, but at least we're continuously developing more security layers and learning more as well about security. And we often think it's easier to steal things online versus physically. I mean, if you go to your doctor now, files are just lying in there. When the receptionist leaves the front desk to get something at the back office, you could easily jump in there and grab a couple of files. They won't notice anything. So at least with online or cloud, there's a couple of layers that you have to go through before you can access that. So we always try to compare the two and to show them that actually it's much better on the cloud than a physical format your practice. If your practice bends, all gone.
Yes, no, totally. And I mean, also you keep on having to have more and more space to fit everything in. And then of course you've got the fire hazard, you've got the dust hazard, you've got heaven only knows what kind of other hazards. And yes, people can absolutely help themselves to a few files. And what also happens, but I suppose with all records, and I mean I've seen it as well, where my husband has got the same initial as my sister-in-law, and then suddenly someone's giving you the results, but they've picked up the wrong file. But it's the same initial and the same surname.
It happens.
Yeah.
And such things are prevented now because everything is sent to the right patient. Each patient has a patient file, and the flows are completely independent of each other. So there's no way one file can be confused for another file. So that's another advantage as well. And also adding analytics that you would imagine trying to analyze the entire paper file. It's almost impossible. But with now a digital file at a glance, you can just, especially now with AI, analyze this file for me. What are the major concerns? What do I need to look at? Can we have a treatment plan for this patient? So it's more engaging now because we have real-time data.
Yeah, and also possible, with your own data. I mean, obviously every GP office has got the data, but it's hidden in files. And like somebody would have to be paid to go and look in each file to go and say, okay, I mean, say for instance, you said, okay, let's run a promotion on whatever, or let's see who I last saw in the last year, you know, who I haven't seen for a year. Or
Imagine
let's
that.
contact everyone between 25 and 35 to see, oh, are you planning on having a baby?
Mm.
Which would
Now,
take
how do you do
forever
that?
to do
Like
that
the
manually.
profiles. Yeah,
Yeah.
that's a nightmare. And one of the offerings that we actually create for healthcare professionals is that we know that you're looking at attracting and keeping patients. Let's give you tools that will give value, because medicine has gone beyond I'm feeling sick, give me a script and a sick note. Patients want to feel heard and valued. They want someone to walk through, the journey with them. And you can't do this if you don't have tools, because you literally have 15 minutes max with the patient. And how do you then give that extra value if you don't have these tools?
Mhm. Yes. Okay, so now I'm imagining, like, say, for instance, we decide, okay, next week we're going to go over to your system. What happens with all those old files sitting in the back room over there?
Yeah, what we normally advise practices when it comes to historic data is that don't spend time trying to digitize every file, because one, you don't even know if some of those patients still exist or they're still in South Africa. But only when patients return, then you digitize that file. So you're able to scan that file, and then you can load it on this new patient file now that's digital. So it's a more efficient way of actually digitizing your files. And from there, you also get to have stats now of who are your returning patients. And then so you get to learn so much in that process. So yes, we do
Yes.
have an option for historic data.
Okay, so it is possible to just scan the old notes and
Yes.
not not have someone manually capture everything.
No.
Shows you
Yeah.
my brain still thinks in the olden days where you go dip, dip,
Yeah,
dip.
now you need data capturers. That's another expert. No,
Yes.
we've made it seamless, and this is why I do believe that we're the only HR that has been used in an academic setting by Wits Medical School, along with the academic hospitals, Bara, Charlotte McLeod, Rahima Musa, etc. Because we're more clinical centric, whereas most systems are more like billing centric and practice management, just about booking and medical billing, but less on the clinical side, because it just requires so much and you need to understand those flows.
Mm. And of course, when you put in a system, you want it to be adopted. But when somebody in the value chain goes, no, I hate it, I won't do it, it's terrible, it doesn't work, and of course you don't want it to be the first, with the clinician who says, no, this is nonsense.
Yeah, true. Yeah, there's also that risk as well. So you find that
Because the
most,
clinician will say this is nonsense and not do it.
yeah,
Yeah.
hence they just focus on the low-hanging fruits, which is billing and the bookings,
Yes.
and it's done. As such, you find that there are so many fragmented solutions. One is offering scripting, one is offering signals, one is offering referrals, one is offering booking. It just creates another mess now in a digital format, because these are not talking to each other, because they're not interested in creating one patient journey like we've done from 10 years ago, where every phase of the patient journey is covered. That way
Yes.
you get to have one patient, one health record.
Okay, and then just for clarity, so in other words, if I go and see 6 different doctors who aren't in the same hospital or aren't in the same wherever, are you saying then that my records could have all of those? Or is it only within a specific hospital
No,
or
because
practice?
our system is driven by the patient, not the practice, whereas other systems are driven by the practice. So even if you have a file with Dr. Soren, so you're able to ask that, can I quickly scan this file on my record so that when I need it, I'm able to share that. And obviously they may ask you not to scan certain parts, which are their personal notes, which is fine. You can look at your problem list and your diagnosis lines, the scripting list, etc. That's still fine. So it's driven by the patient, and also you're able to share with the clinician that you're going to see, whether they're using our system or not. So at least at the point of care, they have your most accurate and up-to-date patient information.
Okay. All right. So with you being driven by the patient, you're obviously doing a lot of education for the patient then.
Indeed.
Yes. Okay. All right. So before we close, so in a nutshell, what differentiates you from the competitors?
Yeah, it's mainly what we've just discussed, that we're more about making sure that patients are empowered, they are informed and actively involved in their care. When this happens, then this actually gives doctors less work, because when they present to the doctor has the most accurate and up-to-date patient information. And with the funder as well, they have the most accurate information. So you prevent fraud, you prevent abuse and waste of funds. And also you help the practice cut so much admin. So all these together, they actually add to accessible, affordable, and quality care. So we're not just focused on certain parts of the patient journey. We're trying to improve this patient journey through the ecosystem. So that's the difference, in that we focus on building an ecosystem, not features.
Okay. All right. So thank you so much. Thank you for coming to talk to us and saying how we need to remove paper from our lives and make sure that it's all digital, especially when it comes to our healthcare.
Thank you so much. I appreciate you, Colleen, and this opportunity as well. And just to highlight one instance where a patient was actually in the UK and they were visiting a GP there. They called us because they couldn't research their password, and we quickly reset their password and they could share their information. So we have a lot of use cases where you would think you don't necessarily need to have your records all the time, but when you need them right there. So yeah, that is why we've also made it free as well. There's absolutely no reason why a patient shouldn't own their health records.
Okay, so beautiful. Thank you. Yeah, and so obviously cross borders too. It's not only local.
Yes, definitely.
Okay. All right, so thank you very much. That was our guest, Lubabalo Mnyaka, and he's been talking to us about how we need to embrace digital and also all the checks and balances that are there, but how it ends up being safer and better for the patient and the healthcare professional, and of course the billing people, if we use a system that's digital. So remember that you're loved, you matter, and you're not alone. And I'll see you all next week. Thank you.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.